because to tell you the truth, most pharmacies they operate now with electronic systems. If you do any Medicaid or third-party pay business in a pharmacy today, everything is done through the computer. And you know, there are people who keep inventories through computers and otherwise. So there's got to be a way in which to track this poly-prescription pharmacy utilization, people shopping doctors, people going from one county to another county, people coming from one part of the state to the other part of the state to get these multiple prescription fillings. Because they're not worried about the co-pays. They're not worried about, you know, they don't want any insurance payment on these things. They just want the prescription products because they're so valuable on the street.
Yes.
Is that true?
Absolutely, and it is a cash business, and it's a cash business that pays top dollar, but also receives top dollar back. Unfortunately, South Florida and other parts of Florida, our state, has become a major source of prescription drug abuse. You said there must be a way, and there is. 36 states have enacted legislation authorizing a prescription drug monitoring system that we've been trying to get here in Florida for the last 6 years. Fortunately, this year in the legislature, we are looking at a pilot program for that for Broward County and for Palm Beach counties. This system will dramatically bring control back to our controlled substances. It is not a law enforcement tool, it's a public health tool. It's a tool for physicians to make sure that their patient is not doctor shopping and seeing other physicians for the same prescriptions, for pharmacists to know that this is the appropriate medication and that this patient is not also going to multiple pharmacies around the community. This will dramatically cut back on the illicit supply of prescription medications that are now being used non-medically. More people died from Xanax in Broward County in our most recent reporting period in 2007 than from any other drug.
No, we were using the brand name, but
as alprazolam.
Yeah, the alprazolam, which is it would be much fairer to the manufacturer.
Exactly.
Because there are, I mean, there's a generic. I mean, most of those products are generic,
yeah.
right?
We generally mention the,
yeah, I understand,
the brand
but
name
I mean,
once.
but you know, well, we tried, you know, really, because I think Big Pharma has been very. I think the pharmaceutical industry has been very responsive from their side of it. And they've been participatory in helping a lot of those states and jurisdictions pass those laws. And certainly the distribution entities, I'll mention Walgreens and CVS and people like that, have been very proactive in trying to do that as well. So I really think that you have a good shot at doing that. But the people out here were worried because a lot of them, especially, you know, of course we do, like you mentioned, the unfortunate abuse that happens in the elderly, the people who are receiving many multiple products by going to the doctor. I have a pain in my ankle, and then I have a pain in my knee, and then I have my arthritis, and they see 3 separate doctors. And I've always warned, I mean, I constantly, it's a mission of mine to tell our listeners, please tell your doctor who you are visited and what prescription drugs and what over-the-counter products you're taking, because it becomes a lethal, potent mixture of products. And good physicians will always ask, but it's really up to those folks out there to make sure that they communicate. I'm sure you see a lot of that. True?
Surely. And medication in our society has an excellent, safe, and effective reputation. Unfortunately, that reputation has helped facilitate the abuse of these substances. People perceive, well, it's a medicine, it must be safe. But as we see, even the safest medications, such as the benzodiazepines, which have traditionally been considered very safe with a high therapeutic ratio, that when combined with other substances, alcohol or whatever, these safe and effective medications can become deadly.
Raymond, I know you work, and we have a wonderful judiciary here, particularly in Broward County, that have been very, very sensitive. I know we have drug courts and things of that nature. Talk about that for a minute. We're down to the last 3 minutes of the show. I'd like to go longer.
Well, one of our judges who has been very proactive, and we actually work with her within the United Way Coalition Against Substance Abuse in Broward County, is Giselle Pollock.
Right.
And she started our drug court program down here, and has been very active in assisting with juveniles and adults who have entered into the criminal justice arena, and it gives them an opportunity of putting their charges on hold, basically. And entering into a treatment program, and if they successfully complete that treatment program and actually graduate the drug court program, their criminal problems are erased, and they can enter back into society and become productive members of society. And it's a fantastic program, they hold the graduations monthly, and if not bi-monthly, and it's just really impressive to see, because Jim was right. You see the people who are really severely substance abuse impaired, and you think that person is never going to get out of this. But if you keep at it, and time after time after time, you'll sometimes see miracles happen, and these people will come out of it, and actually, if you see them when they first come in, and then you see them when they actually graduate, it's like watching two different people, and the life is back.
Well, you know, the great thing is, and we're down to the last minute of this show, the great thing about it is that I've been around long enough to know that the miracles don't happen just because they happen. They happen because of attitudes and advocacies that come from like yourself, Raymond, and from you, Jim, because it's not an easy world to work in. The alcohol and drug abuse and the substance abuse world is just not an easy world to work in. But I have tremendous admiration for both of you and all of the advocates that are out there that have been around for years. And you know, it goes up and down. You get the interest, and all of a sudden it goes up, and then it comes down again, and then it goes up again. It's been happening since the 60s. I mean, there are some advocacy groups out of the St. Pete area and Orlando and Miami and here that have been around forever, 50 years almost, and how they hang on, God bless them, they've hung on. But I want to thank you, Jim Hall, for your advocacy, for your strength and resolve, and particularly leading our Center for the Study and Prevention of Substance Abuse here at Nova Southeastern University. We're going to need a number. We're going to put it up on the screen in case anyone needs to call. It's all, obviously, if they call you, it's within the realm of confidentiality, I would assume.
And our best advice is simply 211.
Right.
That in Broward County, that will get you to First Call for Help. In Miami-Dade County, that will get you to Switchboard of Miami. These are our two county crisis hotlines, which can help people find services to deal with addiction problems.
Okay. And Raymond Ferrero III, sir, you also, my hat is tilted to you based upon your constant vigilance and advocacy in behalf of what I would call a lot of impaired children and adolescents. So thank you very much for these folks out here. I appreciate it.
Well, thank you for having me. It's always a pleasure.
Thank you for being here. Folks, we just wanted to touch on this because we've had a number of moms, grandmas, grandpas that have written to us about, you know, the overutilization of prescription drugs. All of a sudden it's missing or otherwise. All we're trying to do is try to entice you into being a little bit more diligent and also more communicative. You need to communicate with family members if you think they're utilizing your prescription drugs. But most importantly, and as I say to you over and over again, please, please, please communicate with your medical professionals, because what might be in your medicine chest in combination with other products that are going to be dispensed for you could be very difficult for you and therefore your relatives and your loved ones. So thank you very much for your attention. Thank you, Jim Hall, again, for you being here. Thank you, Raymond Ferrero, for you being here. And remember, if you have any questions, you have any comments, you want some answers, just dial us up on this phone number or get us on the web. And we're here every week, same spot. This is called Dateline Health. We come to you from Nova Southeastern University. And until next time, this is Fred Lippman saying, see ya.